Okay. Hello, everybody. So today we got a real good spicy one.
Yay.
And I'm very excited to have Gayle Shotkin on Sage Connections. And I'm very excited to talk about how we work together as a physical therapist, myself, pelvic floor physical therapist. And then, Gayle, I'll have you introduce yourself and tell us
Yeah.
a bit more about what you do.
Yeah. Thank you so much, Loop. I'm so happy to have met again and connect in this way. And so I'm a licensed clinical social worker and AASECT certified sex therapist. And I've been in practice, in solo practice, and recently hired on a new clinician in our practice as well. And I've been going at it for a little over 10 years. And I see both individuals and couples who are primarily coming in because of some type of sexual health issue going on, whether there's a desire discrepancy, sexual pain issues, related to some chronic health issues that are going on, infidelity, gender identity, you name it, anything under the umbrella within sexual health. That's usually what will bring an individual or a couple into the office. And typically always there's some type of mental health issue going on as well, whether there's anxiety, depression, related issues. And so, really peeling back the layers in all of my sessions and, you know, really, treating the person as a whole. And so, yeah, I'm going blank. I lost it for a
No, okay,
sec.
no, this is a perfect intro, right?
Yeah.
Because I treat the physical side of pain, pelvic
Yeah.
pain specifically. And so when we talk about working together, it's interesting to figure out, is there a chicken and is there an egg? Because maybe yes and maybe no. And when a lot of times when I see patients with pelvic pain, specifically pain with intercourse, there is usually, we talk about diagnoses like vaginismus and dyspareunia and things like that. And a lot of times there is a psychological component, and whether it stems from a history of abuse, whether it stems from a a cultural kind of block,
Mhm.
because I think we both see that a lot.
Yeah.
Sometimes we don't know where we get these things from.
Sure. Yeah, religious components, there's,
Right.
I mean, you name it. Yeah.
Right. Yeah. And a lot of the time it's to unpack that.
Yeah.
We kind of need both of us, right? Um,
Yeah.
if somebody, so let's say somebody comes in,
Sure.
do you usually see the individual, or do you work with couples, or do you work with the
Yeah.
individual first and then work with couples?
Yeah, that's a very good question. And so sometimes initially, it's a couple who reaches out. And, we were just talking about pain, right? And you know, I have current clients right now who are coming in with sexual pain, and sometimes they've started off as a couple, and they recognize that, this involves two people. This involves the both people who are involved in the relationship. And, when it starts off that way, it's both partners find this really helpful and not alone, with the pain issues that are going on. And we're really working to, number one, understand it and work with the shame and the guilt and all kinds of feelings that come along when there's a sexual pain, diagnosis. And what that looks like in sessions can really vary just depending on the couple and where they are. Maybe this is a couple who, they haven't been able to have penetrative sex, for example, in a year, several years. It could, be months, and that can vary. And so it's working with that couple to communicate differently, to learn that there are many ways to be physically intimate. And so we're navigating, all of those different ways as well. But going back to your original question, sometimes it might just be an individual who is initially reaching out and there are pain issues and we're starting there and sometimes that transpires into doing couples work because oftentimes if it is just an individual coming in and there are pain issues and they're in a relationship, that can feel very isolating, feeling very alone, feeling like they're very broken. And it can be really important to get that partner, into our sessions and involved if they're open, to, do also doing the work and seeing how they can be supportive and not only that, but how they're impacted by this as well.
Yeah.
And so, yeah, that it can look different,
What
depending on
I
who's coming in.
Yeah.
Yeah.
What I love about your work, and I feel like couples therapy in general, you're just like a translator.
Yeah. Yeah.
In the beginning,
Yeah.
like it's just we don't have the words or the
Yeah.
vocabulary to communicate about this part of a relationship. It
Yeah.
just hasn't really existed
Yeah.
in our culture. And
Yes.
so I think a lot of couples, even if want to they want to understand what's going on because no one just starts off this way, right?
Yeah.
But they a lot of times people aren't in touch of with how they feel.
Mhm.
Um, and if they're not in touch with how they feel and why they feel that way, they can't communicate it to their partner. And then
Exactly.
it just spit, it's just constant
Yeah.
triggering
Yeah.
and blame and resentment. And then it
Yeah.
just spins out of
Yeah.
control
And
until it's
yeah. And oftentimes I hear this a lot, a couple will come in or an individual will come in with some type of sexual health issue, pain, whatever it may be. And sometimes it's the very first time that they're saying this out loud. Maybe they've shared this with a few people, but in general, they haven't shared this. And for the first time, they're able to say, hey, I have this thing going on. And just being able to say that breaks down the shame that sits in there and right away it's being able to help them to understand too that they're not alone in this
Mhm.
that there are many people who struggle with sexual health issues but we're not walking around with signs on our shirt saying hey I have this going on and so again it can be very very isolating and feel like this is just me this is I thought it was the only one and so just that initial appointment can be just very comforting. And so I try to create like just a space where people can just be who they are and share, right? These very delicate and just sensitive topics that we're not typically talking about.
Yeah. And that really parallels what I do as well, because for so many, I treat a lot of, postpartum women who are just told, well, you had a baby, so you're going to pee your pants and sex is going to hurt and is what it is, So a lot of times people don't vocalize until they're sort of either prompted or they feel like they're in a safe space where somebody will understand them and not dismiss them. And so that really is the first step, I think, for both of us,
Yes.
before we can even, I mean, release the, soft tissue and work on
Yeah.
coordination and the breathing and all that stuff. The first thing is just like acknowledging that, yeah, you're not crazy.
Yeah.
You have an issue, but it's
Yeah.
solvable. It might be
Yes. And
intense, but it's
yeah. Yeah. And I think a lot of people, especially women, we see it more often, but women who have pain issues, they often go around to different providers and feel misunderstood or they feel that I hear this a lot. Well, this doctor didn't think that pain was, it was just in my head, or it's that, that just we hear all these messages and the pain is very real. The pain is real, whether there's something psychological going on or not. And so I think that's where right, your work comes in too, and it kind of overlaps, is that we do have to address that pain, as well as address the psychological pieces as well. And again, that's treating the whole person.
right. And what is pain? Pain
Yeah,
is number one, a signal that, it's an alarm bell. But sometimes when we assume that the a little alarm bell that's like, oh, your gas is on a quarter tank or whatever.
yeah,
It does ding when
sure.
you're kind of low, but
Yeah,
you should get, but
exactly.
it's not like it's going to shut down then and then you're just going to
Right.
die and the car's going to burst in flames.
Yes.
It just means you got to get it checked out
Yes.
or take care of it. And
Yes.
I think when people don't understand something, right, there's the fear is exacerbated, and then you go into your nervous system, your sympathetic system,
Yeah.
and then when you're in your sympathetic response, which is the fight or flight,
Yeah.
your pain threshold actually goes down. So you feel pain faster and more intensely than you would otherwise.
Yeah.
And we're all afraid of what we don't understand, right? And so that's why it's so good to just give people the space to learn about what is happening and why it's happening and whether or not, I guess, to learn what their pain is actually telling them.
Yeah.
Because once they learn what their pain is telling them,
Mhm.
and what it might and maybe their misinterpretation of what the pain is telling them, I think that automatically lends to just a calming of the system, and then we can start moving forward. But until that happens, if somebody comes in to me and they're just like, well, my pelvic floor hurts, I
Yeah.
can do a lot of manual physical things,
Of course.
but unless I give them room to speak about where this comes from, how this makes them feel, we're not going to get anywhere. And then, certain things are just really big and beyond my scope. A lot of this stuff is, and sometimes you need to deal with those things in a different space
Yeah.
and then combine the physical with it. But
Yeah.
that's where having you around is so
Yeah,
nice.
like this. Well, this stuff is very complicated, and that's our work overlaps in that a lot again because you know, there's a lot that you're treating, right? It takes a lot of, I think, interdisciplinary work to really treat the person as a whole, and really address what's going on. Um,
Yeah.
and you were talking about the fight or flight response, and oftentimes, I see this a lot, like that's happening for a reason, and in a lot of clients that I see, it's really there as like a defense mechanism in a way, and that it protects, right? It, someone, and it could be multiple reasons, why that is going on. And we talked a little bit at the beginning, whether it's trauma, right? Or just simply grief going on. Like you name it. And so that's also happening, right, within our body for a reason. And a lot of times it's fear, right? It's our body is it's protecting us from going into this very new, uncomfortable space because we're afraid, maybe because of a past, right, situation that
Yeah.
happened.
So
So,
let me ask you this,
yeah,
and this might seem obvious or maybe very intuitive, but
yeah,
let's say someone's watching this and they're like, do I need this?
yeah,
What, who needs this? Who's the best person to be helped? How do they know? Like, what's the trigger? What's something that makes them say, I
yeah,
think I need to talk to her?
yeah. That's such a large question, right? And
I
I think
know.
it's such a large and it's such a large question. But in speaking to those who may be asking, is this for me? I think it's really noticing, is there some type of disconnection going on within myself, right? With my partner, right? And I think it's really acknowledging that, especially when it comes to intimacy as a whole, both the emotional intimacy and the physical intimacy. I hear things from couples that might sound like, "Hey, I've just been feeling like I'm living with a roommate, and this has just been going on for such a long time. My partner just we don't communicate anymore. We're avoiding, just any discussions, even though maybe we try to have discussions. And that's a pattern that can go on for a really long time. I'm just trying to, there's so many,
Right, I know.
different reasons that, therapy could help. And really paying attention to what you're feeling as well. Are you noticing we're feeling down in the dumps more often than not? Are we feeling anxious? Or are we feeling guilt, feeling shame? Just really paying attention to what we're feeling and um, noticing, and instead of, really pushing it down or avoiding it, recognizing that's normal, we're human, and there is support out there to address whatever it is that's going on. Again, I'm speaking, from like a sexual health lens too.
Yeah.
And just something feels off. I see both men and women, and so another just common maybe phone call that I get to are, let's say, women who are having other sexual health issues, right? And maybe they're having orgasmic issues, desire issues. I get a lot of phone calls around, just in general, couples, individuals who are just, there's a lot of desire discrepancies going on. That's probably number one, right?
Hmm.
And when my partner wants to be intimate this often, and well, I don't have desire anymore. That's a whole, I could open up a whole can of worms with that. But that's yeah, there's help, there's support, right? If we're experiencing that. And it's not uncommon. It's not uncommon throughout life to experience desire discrepancies. But if it's something that's not talked about, it can get worse, and it can really have a negative impact on just mental health individually and just within the relationship as well. So I
Absolutely.
know I'm talking, just saying a lot of different things,
No, no, this is wonderful. No, it's
but
funny. It's making me think. So, the last sort of episode I did was with Dr. Pearson. We're talking about
yeah.
hormones and
Mm,
perimenopause and
sure.
the loss of estrogen, and so all
Yes.
sort of like
Yes.
there's a lot of pieces to this, right? So if you see maybe a change in your desire,
Mhm.
that could come from a multitude of reasons. It could
Yes.
be that the partnership itself is just changing and evolving, and um, there's just a transitional phase. There's a mental component, there could be a physiological component, and the physiological component, and then if it all builds on itself without being resolved, then your body starts to respond, right? And then they come to me. So then, whether it's a tissue, sort of lack of tissue robustness, like they used to have when there was more estrogen. But there's an embarrassment, a shame that comes along with that,
Yeah.
and then it just kind of keeps building on itself. Well, I feel like this, and then I'm embarrassed about that, and then I don't want to make him feel bad, but I don't,
Yeah.
so there's just so
Yeah.
much. So
And
just
then there's rejection happening, and
yes,
then that's really common, and then when the rejection happens, we stop talking about it, right? Couples stop talking about it, and
right.
can we and end up feeling very alone. And
Right.
so
And then it like I said in the very beginning, you serve as the translator, like because we all come from wherever we come from and we assume things based on what we were taught or have experience in. And so
Mhm.
some innocuous thing could set another person completely off and trigger them into some sort of stress response.
Yes.
And
Yes.
then that could look like a rejection.
Yes.
And then,
Yes.
so
Yeah, and Luba is so much of the work that I do, or when it's, again, peeling back these layers, but helping clients to put like names to what they're feeling. And once we can start to do that, right, we're able to shift how we're communicating, not only with ourselves, but with, you know, each other, our partners, and you know, if a couple is coming in, it's really teaching a couple how to talk about this. You know, no one's teaching people how do you talk about intimacy or physical intimacy with your partner. And it's so vital. It's so important to talk about it and learn how to feel comfortable and safe talking about it. And that's what I love about the work. And you know, when that happens, it's so amazing, um, just the growth that can go on between a couple or just individually.
Right.
And just
Emotionally, right?
learning how to communicate, learning how to talk about it.
Right.
So
Because how many of us really know what even emotional intimacy is, right? Like it's
yeah.
not just like sweep everything under your rug and smile and everything's good. That's not
Yes.
intimacy. That's
Yeah.
avoidance.
And
Um,
it's one thing I'll ask couples too, like, well, what is your definition of intimacy?
mm,
Sometimes, and you know, sometimes they'll go right to, well, that means sex, right? Well, or that means this. And it, you know, it's breaking down what does that even mean? And no, it can mean so many different things. And again, um we're learning that it can mean so many different things. And again, and navigating that with the couple. Yeah.
and we talked separately a little while
Yeah.
ago. We kind
Yeah.
of touched on this. So I want to bring this up. So you
Sure.
also have kind of questionnaires to help guide people into like maybe they don't even understand themselves. They don't, they've never like dove into that part of who they are even.
Yeah. It's a good question that you ask. So I do have some questionnaires, but one exercise, and I find that I'm giving this exercise or I'm encouraging this exercise more often than not when I'm talking with couples about you know, non-penetrative ways, right, to be intimate. And I'll say, okay, I want both of you separately to take time to name all the different ways in which you would like to be I say physically, if we're working on the physical part, to be physically intimate. And oftentimes, you know, people cross-eyed like, and you know, like, you know, there's some vulnerability in that. And then, and I'll say, and don't worry about what your partner thinks and feels, right? Like we'll worry about that, you know, later. But this is about you. What would you hope? And I'll you know, if they don't know, I'll say go do a little research, you know, just use your imagination, just name it all, right? What would you what ways would you hope, right? That you could navigate being physically intimate. And then I'll have the couple come back together and kind of create this yes, no, maybe, right? Oh, holding hands. Oh, I have that one too. Oh, you know, cuddling. Oh, I have that one too. Maybe, you know, this is a funny one. I had a gentleman, this is long ago, just named me, oh, let's get one of those like naughty, like sex beds or something where we can do different positions. And no, absolutely not. And it was like, you know, and how could you ever think that? So no, right? We're allowed to say no. And that's a deal breaker. I'm not interested in doing that. Absolutely fine. But then the maybes, oh, I didn't think about that. But that, you know, that's something, you know, I'm kind of curious. So kind of a maybe, and let's go back to that. And then we have this beautiful sort of list, if you will, of ways that we can connect physically. Again, that do not necessarily mean penetrative sex. And so it's that often will it starts to engage a couple in communicating in a different way and negotiating without rejecting. You know, hey, I'm not you know, I really don't I'm not into hugging right now, but what about ABC instead? So it creates this new way of communicating for couples around intimacy, physical intimacy.
I'll ask you
Yeah.
one last question that's really big. So just
Yeah. Yeah.
Okay. So consent is huge,
Yes,
right? Especially,
yes,
especially consent for touch.
yes.
Um, what are your thoughts? Like what first of all, like is that something that people intuitively do? Because I don't think that I don't think so. I don't think we're taught to ask for consent. So what are your
Yeah.
thoughts on
That's
consent?
such a that is a lot. It's a really it's a complicated it's not a complicated it's somewhat complicated question. It's a really important question, and consent is vital. And people people I think in relationships for so many different reasons can take that for granted, right? And I hear people say, well, that's my wife. Like, why? I will encourage people to ask permission. Hey, why don't you ask her, if she wants to be, if she wants a hug, or if you can kiss her, or, vice versa, ask him. And, again, I'll get like, well, why would I need to ask? That's, that's ridiculous. I've heard this, or um, that feels so robotic. That doesn't feel organic.
Yeah.
And I'll sit there and I'll say, well, that's a respectable thing to do. And maybe this person, there has been trauma or there's been something that has happened. And that's why it's even more important, right? To ask for permission.
Yeah.
And think again, when couples begin to navigate that, there's this like safety and comfort that's created. But it amazes me, right? How often this comes up, and it's just I'm your partner, and so you know this
Yeah.
should this should just be, and it's yeah,
Well, I think relationships in general, you're just supposed to like know how to do it. You're just supposed to know all the things, how to be a good partner and how to choose a good partner and how to,
right.
it's not intuitive. And
No,
like we're not really taught any of these skills. We just kind of fumble around and hope that we had a good example
yeah,
and hope we catch on to the right things.
yeah,
We're watching the right movies and the right TV shows
mhm,
and
mhm,
not getting confused. So, um,
yeah.
yeah, I mean, that's the other thing is I don't know. Part of me feels like everyone should just be in couples counseling their entire
I think it's great. Sign
like
up.
you go to the gym all the time. You don't just like
Yes.
work out, and for like a week and then you're like, I got it. I'm in perfect
Yeah.
shape.
But
Um,
here's the thing, Luba. It's there's such a significant vulnerability in it. You know, even in like we were just talking about consent, and there's vulnerability in that. Like having to like just even ask permission, because there's risks in that too, right? And that the rejection can happen, and that rejection we know is very painful. um there's so many stories I could share around this,
yeah,
but can it is really important to get to that if it's not already happening.
yeah,
um
beautiful.
yeah.
Yeah, well, we'll definitely have to do this again
So
because
yes,
obviously this is like a huge topic.
there's a lot,
There's
there's
a
so
lot,
much.
and we
Yeah,
just brushed the very, very surface of it.
yeah.
So I'm gonna in the show notes, I'm gonna um, put how people can get a hold of you. Can you tell
Great.
us where you're located and how you see
Yeah,
people typically?
sure. So I'm off of Northwestern and 13 Mile. I'm in an office building at the Wood Creek building, if you're familiar with that. And go to our website, and Luba can post that, and just reach out and any questions, and we'll get back and can help set up an appointment if you're interested in doing that and answer any questions that you might have. Yeah.
Awesome. Awesome. Thank
So,
you so much.
yeah, thank you so
Any,
much, Luba, for having me. I really
yeah,
appreciate it.
any last
Yeah.
words?
No, I think this is great.
Awesome. Okay.
It's
Well, thank you,
wonderful.
Gail.
Yeah,
And
thank you.
be in touch.
Yeah, you too. All right, take care.
Bye.
Bye-bye. Bye.